Good evening, Team Kentucky. This is Lieutenant Governor Jacqueline Coleman here to kick off our COVID update today in the press briefing with some really good news. Our administration, as you know, is committed to providing broadband internet connectivity to every Kentuckian. And closing the digital divide is critical for economic development, education, and creating the jobs of the future right here in Kentucky. So I have an update on the Kentucky Broadband Initiative. 1 week into our speed test, I am happy to report that 31,400 households have participated so far, and that is great news. Just to give you an idea of a comparison, in our first week, we have just about outpaced other states that began their speed test about 6 months ago. The counties that have the highest participation rates so far are Scott, Harlan, Caldwell, Woodford, and Lyon counties. And so I want to say thank you to all of you for making this a priority and to make sure that the rest of our counties join you in that as well. We need everyone, no matter where you are from, to participate. This speed test is the first step to bringing internet connectivity to every Kentuckian. It takes 30 seconds and it is completely anonymous. So what we'll do is we'll take this data and we'll build a map of Kentucky, highlighting the areas that are in the most need of broadband. And once that mapping is complete, we will work with partners, both public and private, to bring fast, reliable internet connectivity to the areas that are most in need. So I'll give you a reminder of this website so you can log on and do this speed test yourself. The website is speedtest.ky.gov. Again, 30 seconds. And completely anonymous. So I'm going to encourage all of you to keep up the good work and to make sure that you participate. Second up, we had our very first Commonwealth Education Continuum meeting today. I am co-chairing this initiative with President Aaron Thompson from the Council on Post-Secondary Education and Commissioner Glass from the Kentucky Department of Education. And our charge is to close the gaps where we often lose our students the most. And that's from early childhood to kindergarten, from K-12 to post-secondary, and then from post-secondary into the workforce. And that requires a strong public education system that is adequately funded, well supported, and cohesive from early childhood through post-secondary life. This work is critical, not just in the world of education, but in producing the jobs of the future, creating transformational change for our families, and building a stronger Kentucky economy of the future. Last but not least, I had the opportunity today to visit a couple of vaccination sites here in Kentucky. I went to the UK healthcare site in Lexington first, and I have to say that I was so impressed with everything that I saw there and the way that they have set up this operation and the way that folks are able to move through and get their first dose of the vaccine in such an efficient manner. From there, I went on to the Montgomery County site where Montgomery County's health department and their public school system are working together. And they have an equally efficient, well thought out system to maximize space and time. And it's just great to see. You know, today I got to be out with those folks and I got to see the collaborative effort from volunteers to the healthcare community to first responders. And I saw so many of our teachers who got to go through and get the vaccine, who are so excited about protecting themselves and their family so that they can get back to the classroom eventually. That efficiency was remarkable. And the gratitude that these Kentuckians showed to the folks who are doing this work was really, really refreshing. I just feel like I got to see a light at the end of the tunnel myself today. And if I had one word to describe these visits to the UK healthcare site and to the Montgomery County site, it would just be hope. I just felt very hopeful seeing so many folks doing this important work. And I mentioned this to the folks when I was there today. You know, we went about our lives pre-2020, and I think we now realize that we took for granted folks like first responders and our healthcare community and our education community. And I think if this pandemic has taught us anything, it is how critical those folks are to our everyday lives. And so I am beyond grateful for the work that I got to see them do today and for what I know that they're doing for every Kentuckian out there. So, Governor, I know you have some more news about vaccines and more updates on COVID-19, so I will send it back over to you.
All right, thank you to Lieutenant Governor Coleman, and let me join her in today thanking every single individual who is working or volunteering at any one of these vaccination sites. But let me also thank everyone who is continuing to perform PCR and other types of testing. Let me thank everyone out there who is still doing contact tracing. Let me thank everybody out there that's still doing enforcement, which I know is not a fun job. And let's remember, as we move forward to defeat this virus, it takes all of us continuing to do our part. Not everybody will be on the vaccination side, which I know is so exciting and we all want to be a part of. But let's remember we need all those other pieces too. Just like we individually need to not only get our vaccines, but continue to wear masks until we've reached that immunity level. It takes all of us knowing that all of our roles are important, lifting each other up. All right, so in our virus update, let's start by talking about the macro. This is still a dangerous time in America. Virus levels are still at some of the highest that they have been since the beginning of the pandemic. And with some new variants, which Dr. Stack's going to talk about, the risks of spread and of harm to you or your family are still at some of the highest that they have ever been. And our number of deaths is heartbreaking, mainly due to that exponential rise. But every day we have thousands of cases. We're going to have significant numbers of death. But both in our country and in our Commonwealth, the trends are getting better. They are currently going in the right direction, by which we mean decreasing positivity rates, overall decreasing cases and stabilization of our hospitalized Kentuckians, those in the ICU, and those on a ventilator due to COVID. But just like when fighting that third wave, we talked about our success being fragile, and we had that 1 week bump due to holiday gatherings, especially with these new variants out there. This trend that we really want to see of decreasing cases, of decreasing positivity rates, and what that'll mean is decreasing number of deaths over time. That's really fragile too, maybe even more fragile with the variants that are out there. I'm convinced that one of the reasons we are seeing trends go in the right way is that every single one of you across Kentucky is doing more and is doing better, even if you were doing it right every other day. More people wearing masks, more people trying to follow the rules. Let's be the most vigilant we've ever been, knowing that victory is around the corner, but we got to protect one another until then. It's a vaccine update. The top line is the same it's been. Our one issue is supply. If we had three issues, they'd be supply, supply, and supply. We can figure out the distribution, and we're going to continue to improve. Tomorrow, we're going to have some major announcements that should answer the question for everybody, where do I go? Now, that doesn't mean that there will be appointments, even when you have that one number that you know that you should be calling. Remember, last week, we vaccinated 82,511 new Kentuckians, even though we only received 56,000 new first doses. So our only limitation at this point, because our capacity already exceeds our supply, is how many first doses we can get from the federal government. But we had three good pieces of news yesterday from the president's COVID team. First, we're getting our first increase in supply that we have had for the most part in this pandemic, except when Moderna came online. It is a 16 to 17% increase where we're going to get about 8,800 new first doses a week. That is incredibly helpful. It's not nearly enough. We could be doing 250,000 vaccinations right now if we had the supply, but we'll take 16 to 17%. We're pushing the new administration. They've been in for 6 days when they announced this. We'll take 16% after 6 days. The second thing they're doing is going to help all of us, all the providers across the Commonwealth. So up until yesterday, we were only guaranteed week to week how much vaccine we'd get. We'd get on the computer on a system called Tiberius, and we'd wait on Tuesdays to see how much we were going to get for the following week. We'd then have until the end of Thursday to tell the federal government everywhere to send it in our state. And then on Friday, we would be able to tell those providers how much they're getting. So they'd only have the weekend to prepare to go on Monday. Having this 3-week guarantee is going to help us start planning ahead. It's going to allow our providers to be able to schedule even 3 weeks out, we hope, as we get this system up and underway. The last piece of good news yesterday was the federal government contracting to purchase another 200 million doses of Moderna and Pfizer, highly effective vaccines that they believe we will get at the end of the summer. So what this says is, we will have a consistent supply, which helps us plan. It's going to be lower than any of us want, but we like seeing increases in it, and we hope they continue. There have been some talk that at the end of this first quarter, there may be some extra coming in under the initial contracts. And then it looks like there may be a significant amount coming summer to late summer, and we've got to have the capacity and the infrastructure, even if that is 1 million doses that we get at that time, to get it out as quickly as we can, and that's our commitment. Just wanted to talk about a few challenges that we've talked about before. It's all numbers based on supply. Challenge number one is the amount of supply we get versus the number of providers who want to help. We have 1,500 providers that are either fully signed up or working on it to sign up in our system. If we used every single one of them at the moment, each one would get about 36 doses. We're not even allowed to ship Moderna in groups under 100 and Pfizer in its groups under 900. So it's not possible. But the second piece of that is you'd have to call 1,500 separate numbers, hoping you were one of the first 36 callers. With the number one complaint being they want a consistent number and place for their region to go to. We're going to have to work on the system that again, we're going to talk about tomorrow that helps give certainty to people. Second is we have to do this regionally. The number of counties we have and their populations don't provide an equitable way to do it. So there's this example today, Robertson County, which is a great place. It's the smallest county by population. If we sent the minimum number to Robertson County, 100 doses, to be equitable in terms of population, we'd have to send Jefferson 36,000. And then we're already at 60+% of our allocation for that week, even though we're only at 19% of the population. Now, when we look regionally, we can get equitable distribution in terms of population there. Now, there are a lot of other areas that we have to ensure equity in the way we distribute this virus, and we are being intentional about doing that, especially each day that we move forward. But from the population piece, to make sure rural Kentucky gets as much as urban Kentucky adjusted by population, a regional approach is the only way that it can be done without picking certain counties that would just lose comparatively. Third piece, as we move down the groups, 1A to 1B to 1C, there are tens of thousands of people in 1A. There's several hundred thousand, if not more, in 1B, and there's 1.2, 1.3 million in 1C. So the infrastructure that's needed when you're going to have 40,000 calls in the first 5 minutes as a provider as we move down changes. And so I hope everybody knows out there we may have to change providers, and likely will, as we move to different groups. That doesn't mean there's not going to be a really important role for everybody, especially reaching targeted populations. But we got to do this right. We can't waste a single vial, and we've got to make sure that as many people that call in at least get a response, and that we don't pull everybody that we have on testing and tracing off of it, move them over just to vaccinations, and drop the ball on protecting people in the interim. All right, so that's a bit of an update. Remember, this is the most significant logistical challenge probably since the end of World War II. We're up to it. We're already outpacing our supply. But we're going to need trust. Remember, we built the nation's model in testing from nothing to what we had. We're going to need some patience. And in many ways, we're going to have to think about the we, not me, as we move through, and in each time period we're in, ensure we have the very best structure to deal with the groups and the size of the groups and the complex needs of the groups that we're dealing with. All right, today's COVID report has some good and some bad, mainly that we talked about earlier. Today we're reporting 2,424 new cases of COVID-19. Again, that number is far too high, but it is the lowest Wednesday in 4 weeks. When we look back to January 6th, there were 5,742 cases of COVID-19. Today, less than half of that. Overall, that is a good sign. If you look at our hospitalization numbers, slightly up, ICU and ventilators slightly down. And good news, positivity rate continues to fall, 9.35%. We like seeing that steadily fall. We have our fewest number of red counties in a while, though there are still 111 of them. What hurts is we continue to see really high deaths with 47 new deaths for a total now of 3,542 lost Kentuckians. New cases by county: Jefferson 330, Fayette 180, Davis County 102, Kenton 88, Boone 82, Warren 76, Pike 70, Madison 67, Pulaski 62, Hardin 56, and the rest can be found on kycovid19.ky.gov. Like I said, 47 new deaths today. That's a hard figure. They include an 87-year-old man from Barron, an 84-year-old woman from Campbell, 67-year-old woman and a 78-year-old man, both from Christian. Davis County has 5 lost Kentuckians. They included two 86-year-old women, an 87-year-old woman, a 99-year-old woman, and an 83-year-old man. Fayette County lost an 84-year-old man. Fleming County lost a 79-year-old woman and a 96-year-old man. Graves County, a 73-year-old man. We lost a 77-year-old woman from Greene County. We lost two Harlan County residents, an 89-year-old woman and a 73-year-old man. We lost a woman in Harrison County, first county where we had a case of COVID-19 on March the 6th. In Hart County, 3 individuals, 2 women ages 73 and 77, and a man age 71. 77-year-old man from Henderson, 76-year-old man from Hopkins. In Jefferson, 3 women ages 56, 69, and 72, and 5 men ages 57, 68, 69, 73, and 81. 2 individuals from Kenton County, a 66-year-old man and a 91-year-old man. Menifee, 6 losses. 3 women ages 64, 75, and 80. 4 women, also one age 87, and a 75 and a 90-year-old man. Ohio County, 81-year-old woman. Rowan County, 80-year-old man. Todd County, 77-year-old man. Warren County, 46-year-old woman, 70-year-old woman, 95-year-old woman, and a 39-year-old man. Wayne County lost a 75-year-old man, and Webster County, a 69-year-old man. Our school reports this week thus far, and that's just really Monday and Tuesday. We're still waiting for today. 703 new positive cases in students, 288 new positive cases in staff, 3,680 new quarantine students just in those first 2 days this week, 481 new quarantined staff. Long-term care, another 28 positive residents, 14 staff, 24 new deaths attributable to long-term care. It appears as a percentage of our deaths, long-term care is going down slightly. It is certainly the largest portion. That's why we're vaccinating it so quickly. And this is actually some of the fewer cases that we have had in a while in long-term care. Now, today, like most days, we have a memorial. It helps us remember that every flag we planted out here represents a person. The demographics that I read represent a person. And today, that person is Ernest Bates, who is one of our own in state government. Today, we're sharing the story of Ernest A. Bates, who is a heating, ventilation, and air conditioning inspector with the Kentucky Department of Housing, Building, and Construction for over 13 years. He passed away at age 76 from COVID-19. Outside of his 13 years at the state, Ernest was in the HVAC trade for over 48 years. He had his journeyman and master HVAC contractor's license, as well as a master and electrical contractor's license. He took pride in his work, knowing that his efforts were helping the citizens of the Commonwealth. Ernest stayed busy. He enjoyed buying and restoring old tractors, which you see here, barbecuing, visiting with friends, and camping. He was also a member of the Rumsey United Methodist Church. More than anything, Ernest enjoyed being with his family, who are now mourning his loss. Ernest is survived by his wife of 98 years. Her name is Nancy. His son, Alan, who also works as an HVAC inspector with the department. His stepdaughters, Robin and Tony, 9 grandchildren, and 2 great-grandchildren. Today, we lift up his family in prayer, and we give thanks to the many years of service he gave to the Commonwealth. To Ernest's family, we are so sorry for your loss. As a state government community, we grieve with you, and we want to continue, all of us in the Commonwealth, everybody who's watching or listening, to do better. We want to be there for your family in this time of grief, just like we want to be there with everybody else's family. We want to get these vaccines out. And until everybody's had a chance to get them, we want everybody wearing their masks so that other families don't have to go through what Ernest's family are doing. To his family, we care about you. We love you. We want to be here during this tough time. All right. Now we've got Dr. Stack to talk about a number of things, including the importance of continued testing, but also to specifically talk through the new variant, finding it in Kentucky in 2 separate cases, what it means for us, and the steps we ought to be taking.
Thank you, Governor. Good afternoon, everyone. It's good to be back here in person. I have 3 things I want to talk to you about. The first thing is the new variant. James, could we put up the slide that I made for that? One of the things I missed the most about not being here in person was it was harder for me to share some of these little things and draw attention for any of the younger audience that's still watching me. So science is cool, even though it's not always happening in a context that's fun. So let me use this as an example. That's a website up there, gisaid.org. It's www in front of that. This website shows the genomic mapping of the SARS-CoV-2 virus, which is the virus that's causing COVID-19. On the left-hand side of your screen, you can see those lines with all the dots. It goes blue, dark green, light green, all the way down to yellows and oranges. If you go all the way to the bottom left corner of that, that is the very first genomically sequenced SARS-CoV-2 virus. So that would probably be the Wuhan variant for where this all started. From that one variant, or from that one virus, over time, mutations occurred. And this is typical. This happens in viruses all the time. As those mutations occur, you start to see branch points where essentially new families or new branches of the families of the virus develop over time. And the longer this goes on, the more you see more distinctly different families that develop. So across the bottom of that graph, it's hard to read, I'm sure, on your screens, but across the bottom of that graph, it shows months. So you're moving forward in time from the left-hand corner to the right-hand side. As you go up, that's just showing further variation, new mutations that are occurring in the virus. The vast majority of these mutations have no clinical meaning. They have no implications for us for the infection. They're mutations that don't make it more contagious, that don't make it more lethal. They don't functionally have an impact on us if we get infected by it. But that's not true for all of the mutations. Some of the mutations do cause the virus to become more effective. Where it causes the virus to be less effective, those generally die off. Natural selection weeds those out. But where it helps the virus to be more effective, that's where it's a problem. We have found now for the first time in northern Kentucky, in Kenton County, 2 individuals who tested positive and have subsequently been found to have the B117 variant. That's the one that we believe was first found in the United Kingdom. That variant is more contagious. So I want to put this in context again in a different way. It spreads more easily. It means if you get exposed to it, you may be more likely to get infected by it. And so that means that it can infect more people more quickly. It's not more dangerous for the person who gets it than the previous version of the virus, but since more people can get it more quickly and more easily, that means you could have more people get sick, more people who die. Not because it's more lethal to the people who get it, but because a lot more people get it, and then that changes the overall number of people who have the worst outcomes. So it is more important than ever that we wear our masks, that we watch our distance and stay 6 feet or more from each other, and that we wash our hands. And if you get exposed, please stay home and quarantine. If you have symptoms, if you have fever and cough and infectious symptoms, please get tested if you think it could be COVID, and definitely stay home until you're well. Those variations, the more we let the virus spread, the more the virus has a chance to replicate, the more mutations occur, the more risk we have of more harm and danger. So please, wear your mask, watch your distance, wash your hands, and stay home if you're sick. I want to thank Gravity Diagnostics. They, along with others, there's certain laboratory equipment that runs certain assays that allow us to find some of these. So this was called an S-gene dropout. There's a certain pattern that shows up with that variation, the B117 variation. When that shows up, it alerts us this might be that B117 variant. Gravity Diagnostics works with us, as do other labs, and they found that pattern in these specimens. They sent the specimens to our lab here at the state, and we did genetic sequencing, and that's how we found that. So thank you. I have one other point to mention, and that, the importance of testing. I have 2 other points. If you could put up the testing slide, James, so I can remind folks about this. On our website, kycovid19.ky.gov, up at the top, there's a navigation bar, and it says testing, COVID testing. If you go there, there are 364 locations on our map. Now, I suspect there's even more than that at this point, because now that it's so much easier to get, probably sites aren't always coming to tell us. But please, if you have a site and you're not on our map, there's a registration link on the page. Please identify yourself so people know you're there. There's also a list for where we have partnerships with some local health departments, the federal government, Norton Healthcare, St. Elizabeth's, University of Louisville, University of Kentucky. Those are places where the state continues to support testing that is provided at no charge to those of you who sign up. So please take advantage of that and make use of that. The last point I wanted to mention for tonight is about the vaccines. I'd like to highlight just a few points the governor mentioned. I mean, I'm real proud of the public health team and the state government team at large and the local health departments we've worked with. Team Kentucky has really done a good job, folks. I mean, that sounds self-serving, but it's not about me. There's this team of thousands of folks across the state working on your behalf. The end output of those results are that we've had some of the best testing in the nation earlier than many places. We have the lowest, among the lowest mortality rates, in the top 10 for the lowest mortality rates in a state that has bottom 10 overall public health standing, unfortunately, because of the challenges we face for overall population health. There are a number of things. We've never had a hospital yet get overrun and overwhelmed. That's a lot of hard work from a lot of people, and thanks to the entire state and the public health community and the hospitals and the doctors and the nurses and all the other clinicians and all the state government employees and local government employees. There's been a lot of people working on your behalf. With the vaccine rollout, when we started this week, when you looked at everything we could have administered through the end of last week, the governor shared this previously, we had already administered 88% of all the inventory given to the state program to use. The long-term care facility program has had a slower rollout, but the state had given 88% of all the inventory it had to give out. Remember, we set the target on January 4th for 90%. That's pretty good 3 weeks in to be that close. As I stand here today, even with all the new inventory we got, and even with the fact that we reclaimed inventory from the nursing home program that was unused to redeploy into test locations, we've still already used 76% of all the inventory the state program had to give, and we still have 5 more days in this week to use up the rest. Our state has been a leader on this. Only 53% or so of the total inventory shipped out nationwide has been used. And I'm standing here saying that even at the beginning of the week when we just got an influx, we're already standing 76% of everything we've gotten at the state program's been used. We have a long way to go. We intend to improve this and make this best in class service. The problem is quantity, quantity, quantity. We don't have enough. And so I need to ask everyone to be patient. And let me put this in context real quick. As I stand here right now, we have immunized at least 90,000 people 70 and over. So that means we've gotten 90,000 out of about 490,000 people 70 and over. And that was as of yesterday. So as of today, that number will have gone up. We have a long way to go. But even though I know it's been frustrating, there's still 400,000 people or so 90 and up or 70 and up who have not yet had the chance to be vaccinated. I know I've asked for patience. The governor's asked for patience. We're methodically making progress. And in February, that is going to be the focus as we enter February, to get the rest of the folks who are 70 and up who want to get vaccinated. And I'm confident we're going to make really good progress. When you get the vaccine, it is normal for you to have a sore arm where you got the injection. That's normal. That's your body responding to the stimulus. That's the vaccine. It is normal to feel achy, to feel tired, to feel a bit run down, to feel like your energy's lower. It's even normal to have a low-grade temperature. Those things are normal. That is your body's immune system responding as it is supposed to a vaccine. I've been surprised actually in talking to people who say after they get a tetanus booster, after they get other booster shots, some people's immune systems just respond more strongly. That is normal. It's not a side effect. It's not a complication. It's not a reaction. It is your body's immune system responding as it should to the vaccination. So if you have that, please know that means your immune system is doing what it's supposed to do and is now going to be better primed to prepare you. It remains a privilege to serve. I'll be back tomorrow. We'll have a lot more information about the vaccine rollout. And thank you, Team Kentucky. You've done a great job. It's been a privilege to serve you. And I'm confident as we go forward in the months ahead, we're going to get a lot more people protected with the vaccine, and things are going to get better as we enter the spring and the summer. So thank you very much. And thank you, Governor.
All right, actually running ahead of schedule for one day. Let's open it up to questions. I know there was one question written about the CDC listing on its list that would qualify for 1C smoking. We're not going to prioritize someone into another category simply because they smoke. Those that have the different types of conditions that could have potentially arisen from it that make them more vulnerable will fall in that category, but no, you can't smoke your way into 1C. I appreciate that being pointed out. We'll make sure that that is clear on our website. Kristen Shanahan from WDRB.
Hi, Governor. Now, my question is going back to the roughly 17% increase in vaccine. What will the total number of doses that Kentucky will be getting?
I believe we're going from, and we'll get you an exact figure, about 56,000 new first doses. We get first and second. We're really focused on the first because that corresponds to the number of people. It's going up 8,800. And so what we believe is we'll be able to vaccinate about 8,800 more people. And so with that, we'll be getting what about 65,000 supply will allow us to vaccinate between 64 and 65,000 people a week. Those will be the first doses. Obviously, we need a lot more. When you divide out the number of people that we need to hit herd immunity, which is 3.1 million or so, we need more supply. But that gets us to between 64 and 65,000 appointments there should be each week for people to get the vaccine. Mike Valenti from WLEX.
Yeah, Governor, thank you. My question is a two-parter for Dr. Stack on the COVID variant. I know you said, Dr. Stack, that the UK variant is more contagious, not more lethal. Is there another variant that's been identified around the world that gives you more pause, whether it's the South African variant or the Brazilian variant? And I know it's thought that the vaccines are still considered effective against the variants, but is there any possibility that if they become prevalent in the U.S., that you may need a third booster shot?
Right, so those are all wonderful questions, and there's not complete answers to all of them. So most of the variants that are significant appear to be more contagious or transmissible, but not necessarily more dangerous. I think it is the South African one that was identified that may actually be better at sticking to or adhering to your cells and therefore being more effective as an infection. And and I may be tangling that a little bit, but there's at least one of them that may be a little bit more dangerous. For all of them, the vaccines are still effective and still valuable. So I want you to put this in context. These vaccines, these two mRNA vaccines, after 2 doses are 95% effective for preventing severe COVID disease. That's phenomenal. Most vaccines are not that effective. Even if the virus gets a little bit more efficient or more successful, that success rate is still so high that those vaccines are incredibly important. But here's the thing everyone really needs to know. It is absolutely essential that you wear your masks and stay your distance and keep doing all those measures, because if this virus is given more and more and more opportunity to replicate in more people, it will continue to evolve, and it evolves very rapidly. So it is essential that you still wear your masks and that you do get the vaccines. And I know there's been some coverage about Moderna perhaps tweaking its recipe, if you will, in case there's a need to do a third booster. If they were to do something like that, what they're going to do is think about, for those of you who know milk duds, the mRNA is like the malt in the middle, and there's this lipid nanoparticle that's like the chocolate on the outside. Well, for that malt in the middle, they can change that. They can change the programming in there while still keeping the same outside layer. And by doing that, they can more quickly refine the technology. So if they need to give you a third booster to help give you just a little extra protection against a new variation, that is scientifically possible. And it's one of the amazing things about the mRNA vaccines. You can essentially change the coding inside of it without having to reinvent the entire technology around it. It's pretty cool. And time will tell if that's necessary or not. But you should all get the vaccine. And if people say which one, particularly since the Janssen vaccine hopefully will go forward for approval soon, if anyone says which one should I get, it's the one you can get. Any vaccine you can get is better than the one you can't. So I would say get whichever one's available to you at the time it's available. Thanks.
Mike, I'd also point you to the White House Coronavirus Task Force today. Their update, they had slides, and they had slides on this. I believe if you pull them, their wording was that with the UK strain, there was a minimal decrease in the protection that the vaccines gave you. I believe they used the word moderate with the South African one. But when you have 95% effectiveness of these vaccines versus sometimes 60-something% of the flu vaccine, even with that wording, I think you could still have some pretty powerful protection. But their specific wording is on those slides that I know are publicly available. Kenny Bass from WCHS.
Hi, Governor. Thanks for the time. A couple of quick things. One, the CDC report, which came out showing that schools, especially with younger children, are very safe and have a minimal amount of spread. How does that impact your thinking on getting all of Kentucky's schools back open, maybe more quickly than is planned right now? And secondly, with the impeachment winding its way through the legislature, and we all know that it is a political tool, it's not necessarily a legal tool, but taking that in mind, how much do you think of this movement is based on purely on political ideology? And do you take any responsibility at all from any of the actions that you took during the beginning of the pandemic to today, to where you think you might have prodded or goaded or moved people in that direction to make these moves? Or do you feel blameless and believe that it's purely political and it's reactionary based on ideology? Thank you.
Okay, on the CDC school report, I would just suggest everybody read it on the whole. It says that local officials, when it can and should open schools, that they can be safe if those local officials close restaurants and bars and gyms. That's all in the same report. Now, the report does suggest that we are on the right track, though, to open more schools and for longer. But the experts that have reviewed that today, all day, we're talking about the number one thing that we can and should do is vaccinate the workers that work in the school. Well, at the end of next week, we will have had the first round of vaccination for every school employee, K through 12, that was willing. So we are going to be the fastest state to get there, to have the very safest schools. And yes, after we get through that process, I believe not only are our schools safer than many places, which they already are because of the good work that those schools are doing. But they're going to be even safer for the adults that work there as well. Still, one concern I have is the studies focus only most of the time on the kids, and that's most important. But those people that work in the building are too. So we're certainly going to be able to loosen our guidance. Remember, we don't have any order that prevents in-person learning at the moment, but we do have guidance. We're going to be able to loosen that significantly once everybody is through. We do have an order out there, though, that does require a virtual learning option for students and accommodations for teachers. Some of those accommodations are going to be able to be loosened or removed once we have folks that have been offered the vaccine. On the impeachment, I'm trying to be the adult in the room on this because I think it's more than a little silly. And let me give you a comparison. So here in Kentucky, I've taken the actions that I've needed to, same actions that other governors have taken, virtually every action recommended by then Vice President Pence and his group. And our Supreme Court has ruled them constitutional. And I'm dealing with a petition filed by 4 individuals, one of which has done a threatening video. Others have made threatening comments, and the legislature seems to be giving it time. I want you to contrast that with Michigan, a place where the Supreme Court ruled the governor's actions unconstitutional, where the petition was brought by legislators, and where the Republican Speaker of the House shut it down immediately, saying it was shameful. It wouldn't be close to giving rise to impeachment. And when you look at this thing, you can't say, do you think you shouldn't have taken certain actions so certain people wouldn't be mad at you? I take actions to save lives, but what I can say is none of those actions are anywhere close to an impeachment standard in Kentucky. In civil discourse and in politics, you should be able to argue about things. Heck, people can even yell about things they dislike. But this tool, I mean, it's silly and it's not close to being appropriate. And I worry that we're giving more oxygen to one of the petitioners who called for the hanging of Mitch McConnell in a post because he voted for the Patriot Act. That's wrong. And to give them more oxygen is wrong. So every time in the past, these have been reviewed and tossed aside. They should be here as well. Creating a new standard just because there's a highly charged political environment isn't good for us going forward. But I'm going to keep doing my job. We had to make tough decisions along the way. I knew I had to make unpopular decisions along the way. But with the knowledge we had at the time, the steps that we took were taken virtually everywhere across the country, and were all intended to save and to protect lives. So we're going to keep doing the right thing. If I would allow myself to be intimidated or bullied by petitioners or others in the midst of COVID, it would cause me to either make decisions or not make decisions that would cost the lives of Kentuckians. And, when I'm done with this job, at least when I look back on this time during COVID, I want to know that I did the right thing, no matter what people threw at me. Even if folks were trying to make videos talking about my kids, which has happened again recently. I'm going to continue to do the right things. Shelby Smithson from WKYT.
Thank you, Governor. Is the 16 to 17% increase in Kentucky's weekly allocation essentially the response to your request to double Kentucky's allocation? Or have you heard yet, or do you expect to hear a separate kind of response from the federal government to that request?
Well, I think it's in response to every governor's request for more supply. That's even in places that aren't distributing it as quickly as they should. They will eventually get up to speed and reach the point where their capacity exceeds their supply. And our worry originally about vaccine hesitancy, we're going to have to worry about that later. But right now, it's the opposite. It's so many people wanting it so badly. I'd love to think it was our request, but everybody across the country is getting this increase. We haven't gotten our direct response yet from the Biden administration. I imagine we will. Certainly, I've got a couple of folks that I've worked with in the past on their task force that have been really responsive and heard me out on different areas. I had that same ability with the Trump administrations. Both task forces have communicated well and have been willing to take my call, which when your job is to push like mine, you appreciate people continuing to pick up. Again, we need a lot more than this, but this is the first increase. It's happened pretty quickly. And what I hope is that the president and his team feels the urgency of increasing supply, and I think they do. Joe Ragusa from Spectrum.
Hi, Governor. So I want to talk about restrictions, since we're a few weeks out now from at least, the Christmas and New Year's holiday. Given where things are at right now with, I guess, the way that cases are declining or at the rate that they're declining, have you thought much either in favor of more or less restrictions, how, you approach, what restrictions we need to have at all, either, restaurant guidelines, bars and their capacity limits, anything like that? Have you thought much about where things are going to go from here, or is it still too high to tell right now?
Yeah. Still too high, but the trend is going in the right direction. So these are all things we can start considering. 2,400 cases, 9+% positivity rate, too high, but moving in the right direction. And so they are things we should begin considering. Also, when certain groups go through the vaccination process, we can think about easing things as well. Certainly, guidance in school is one of those. But I, again, we can be hopeful about the direction and what it would mean, as long as we still don't underestimate this virus or its variants that can very quickly take a turn and eliminate the gains we've made. But I'll tell you what, more people wear their masks out there. The more people continue to do the right thing, the more these numbers go down. The answer is yes, and it's always been yes, that we can ease certain things once we get to a better place, and we have in the past. Corinne Boyer from WEKU.
Hi, Governor. Some school districts in Kentucky have reported that anywhere from 50 to 70% of school staff are declining to get the vaccine. And then in Ohio, only about half of nursing home staff have said they'll get the vaccine. Is Kentucky keeping track of the percentage of vaccine refusals within public schools or long-term care facilities? And have those refusals complicated any vaccine delivery schedules?
So again, we'll check with KDE. The way that schools went is we asked each school for the number and even the names of people who are willing to get it. So that, I guess, first refusal would be done by comparing those numbers with the overall numbers of staff. I certainly believe it's in the 70+% even statewide of school personnel that are taking it. On the long-term care side, it's a little more complicated because the federal government is doing the program. People have asked me at different times if I have any decision I'd make differently. If I could go back in time, we would have administered the long-term care program on our own through community pharmacies and others. Not that our partners haven't worked. It's just with the contractual relationship with the federal government, we've had less control. But we do see opportunities to work with them moving forward where the relationship is different and more direct. So I don't have numbers for you today, but I can tell you that there was certainly less than half, but a significant portion of our long-term care staff that initially said no, but are already saying yes. It was what I would call a soft, not a hard no. That it wasn't that they didn't want to take it, it's that they felt like maybe it had been rushed. They had concerns about its efficacy. And as they saw other people getting it, they now want it. And we're seeing this all across Kentucky. Different groups that I was talking to some pastors today. There'd been some hesitancy in a number of members of their church. They now want it and want it as fast as they can get it. That's we're seeing major movement in that direction. Debbie Yetter from the Courier-Journal.
Hi, Governor. Do you all have any more information about the Kenton County individuals that you can provide? Were they connected some way? Had they been out of the country? And also, is there any reason to believe the spread of that variant is limited to those two people in Kentucky right now?
Well, I'll ask Dr. Stack here in a minute about the first, but no, the way this thing spreads, I think we should assume it's moved beyond those individuals. We are casting a wide net to find and to check different positive tests for this. I think we found it in less as a percentage with these two than federal government or other testing. But we've got to assume that given how infectious it is and how it more aggressively spreads, that it's beyond the two individuals. And the CDC is saying this will be the dominant strain by the end of March, if not in early March. So just like when we stood here on March the 6th and said, we know it's going to spread, right? Let's be ready. Let's not respond with fear, but let's do the right things. The same here. I believe that we've provided all the information on the two Kenton County individuals that we can. Dr. Stack, is there anything else we can add? Okay, but the two individuals are doing okay. Okay, that neither are hospitalized. Okay. And again, that coincides with our general belief that while it spreads more aggressively, we don't have any, and I've read something out there, but we don't have any definitive information that would suggest it's more deadly. Tom Latek from Kentucky Today.
Good afternoon, Governor. How are you today, sir?
I'm doing good. Thank you.
Good. I hear from a lot of people, and I had an interesting one today. This woman was telling me she has a 91-year-old mother who lives alone, but the woman gets her groceries and helps take care of her, that kind of thing. The 91-year-old has tried to sign up for vaccines, but they want her social security number, which for identity theft reasons, I guess, she's reluctant to give other than the last four numbers. Is there some kind of alternate ID people can use when signing up for this?
So I'm not sure where she's trying to sign up. It would seem that the full number wouldn't be necessary, but that's something that we can check in to and provide her other means. Tom, if you could send, as long as you're willing, that individual's name to us, we'll contact her for two reasons. Number one, to help her specifically, and number two, to hear what and where and how she's being asked for this information. This is the type of feedback that can help us as well ensure it's being done right. Especially for those over 70, tune in tomorrow or make sure you check in with your local media outlet Afterwards, there's going to be some more opportunities to sign up. And certainly with other 1B programs winding down, I believe those over 70 are going to find more and more appointments available moving through these next couple weeks. But remember, if we're only getting 64,000 doses a week, and we got about 400,000 people over 70 that are still looking, whatever portion are looking to get it, it's going to take a number of weeks to get there. It's just the math on the supply. Melissa Patrick with Kentucky Health News.
Hi, Governor. I have two questions. So I want to make sure that I understand Dr. Stack. I think I heard him say that the discussion about moving the extra long-term care vaccines over to the state, I think I heard him say that has already happened. And if so, how many vaccines ended up in that transfer? And then my second question, unless you're going to wait a second.
Sure. I think it was about 13,000. 12,675 first doses. They have been and are being moved over this week.
Okay. Well, then my second, thank you, sir. The next question is, so the Biden administration is planning to start sending vaccines in limited amounts to some independent pharmacies in some states. So that's a lot of vagueness. Has Kentucky asked to be one of those states? And if not, at what point will Kentucky include independent pharmacies?
And the answer to that is when we have supply. I'm a huge fan of our independent pharmacies, so much so that I investigated PBMs in the state as Attorney General, believing that they were harming, and I still believe that they were harming our independent pharmacies, which are pillars of our communities. We continue to work on the Medicaid and other side and ensuring that they are fairly compensated for their great work at helping to take care of our individuals out there. We are talking with FEMA. We're talking with the Biden administration. We want all these programs, but it's all about supply. And the Biden administration agrees. If we can get a huge influx, then absolutely. We want 1,500 different providers if we have that opportunity, each with specific goals. But again, it runs into our math. 56,000 doses, what we got last week, divided by 1,500 providers already signed up, 36 doses too small to ship, and 1,500 different numbers to call. So I think where we're going to ask our independent pharmacies and our long-term care, what we're going to be asking our independent pharmacies and our health departments to do is really critical, targeted outreach to difficult to reach folks that are never going to be able to come to a regional site. These are people that are in each and every one of our communities that already know and trust our pharmacists and or our health department. This is going to be one of the important parts and ways to get to herd immunity, and it's going to be a lot to ask of those groups. But I hope they know they've done such a great job already. We are going to need to call on them more, and it's going to be a challenge, but I know they're up to it. Karen Czar from WUKY. Karen, you get the last question. Normally you're first.
I feel so popular. This is for, and hello, Rachel. This is for Dr. Stack. Does the UK variant or any of the other variants seem to cause a faster pace of symptoms? And if you know that you were exposed, does it at all change your quarantine in any way? And can you talk a little bit, if there's time today, if not tomorrow, about double masking, when, where, and if? Thank you so much.
Wonderful. So thank you, Karen. Let's try to sort through the things you just asked. So first of all, the double masking. If you have additional layers in front of you, it reduces the transmission of things through it. So we already recommend 3-layer cloth masks. That's already part of this. The best thing you can do is to stay more than 6 feet away from people, because then you just aren't close enough to get exposed. So one, I would say maintain your distance and wear your mask. And I would worry less about double masking than just making sure you wear a mask and stay more than 6 feet away. Karen, you asked a couple other questions. Can you jog my memory on the other elements of it? If she's still there.
Do any of the variants I'm on mute. Can you hear me now?
I gotcha.
Do any of the other variants that we know of seem to cause a faster pace if you're going to get the symptoms? And does it at all change quarantine?
No. So thank you, Karen. So no, the onset still seems to be 5 or 6 days for the typical person post-exposure. The typical person still is probably infectious about 2 days before they get symptoms. Alarmingly large number of people, probably 40% or more, appears not to ever have symptoms, which means there could be spreading disease but not show signs, and it doesn't change the quarantine. Everything would still seem to appear consistent that when your symptoms are resolved for 72 hours and you have had 10 days since you either tested positive or became symptomatic, then you are freed from isolation. So all of the other guidance it remains the same and unchanged at this point. And this is the first time I get the privilege to do this. I get to send us all home for tonight. So Karen, thank you for the last question. And to Team Kentucky, thanks for all you do. I cannot begin to tell you what a privilege it is for all of us here to serve the state. It's not always been easy. I think I'd be a liar if I said it were. But we are all continually honored to serve you. And I have every confidence that we are going to get to a better place. And that as we enter the spring and the summer, it won't be normal, but it's going to look a lot more like the world we used to know. So as the governor says, we'll get through this. We'll get through this together. Thank you very much. And I hope you have a nice evening. Good night.
Governor Beshear and I are committed to closing the digital divide for Kentucky families. To do that, we need your help by taking part in our speed test. This test is quick, simple, and totally anonymous, and here's how you do it. Step 1, visit speedtest.ky.gov. Here, you can choose to enter your exact address, a partial address, or an address with no available service, and I'll come back to that part in a minute. Step 2, click on Let's Do It. You'll enter your address and click the Check Address button to continue. Step 3. Now all you have to do is select I agree and begin. And that's it. You're done. Now back to the part about not having internet access at home. We definitely need you to take part in this test. You can connect on any wireless network at a business, local library, or a friend or family member's house. You'll choose Enter an address with no available service, and after entering your home address, you'll identify the reason you do not have access at home. So come on, Team Kentucky. Let's work together to close the digital divide and build a better Kentucky for everyone.